And so I've been telling a lot of people that, you know what, you just need to take a deep breath before the interview because at the end of the day, you are qualified. They wouldn't have interviewed you if you weren't.
Good evening, everyone. It's Vrushangi with the Fellowship Review through the American Journal of Healthcare Strategy. Today, I am so excited to not only be joined by a friend, but also a peer from my undergraduate institution. Sandy, thank you for coming on the show.
Of course. Thanks, Vrushangi.
Yeah, so why don't we kick it off and why don't you tell our listeners a little bit about where you're from, your background, your schooling, and where you are currently?
Awesome. I would love to. So, hi, everyone. My name's Sandy Amorado. I'm currently working at Mercer as an associate, but I was an administrative fellow with Hartford HealthCare in Connecticut. So, I'm excited to talk about my experience with Hartford and the fellowship, but also just talk about anything else under the sun.
Yeah, absolutely. So excited. I know this will be a very unique episode. I actually want to take it even a step back before you get into your career journey. So tell our listeners about where you did undergrad, where you did grad school, and what your degrees were in.
Yeah, so I actually did my undergrad and my graduate at the same place. So I went to St. Louis University in St. Louis and I got a bachelor's in psychology and then I got my MPH in health management and policy.
That's incredible. Obviously, go Bills. And the reason why I wanted you to highlight your graduate education specifically is because really, I think you're one of the first or one of the only people that's been on the show so far that actually has an MPH. And really, I wanted to bring to light that applying to fellowships isn't only for MHA students. You can apply if you're an MPH, if you're an MBA, and a similar degree. So thank you for sharing that. And one of your experiences that I really want to highlight because it's such a cool health system is your graduate administrative internship with SSM Health, Cardinal Glennon Children's Hospital. So could you tell our listeners about how you got that internship and what that experience was like?
Yeah, so I actually got the internship through my school. So our a director at the time, Marcia Walter, she helped us a lot trying to find our internships. And I just saw an email and I was like, you know what? I want to apply. How's the application process like? So we went through the whole process. And after I did that, I got the fellowship because I knew I really wanted to do pediatrics in the beginning because I love to work with kids. And so the fellowship really brought to light pediatric healthcare, what I can do in my future career, and the different types of projects, whether that's patient wayfinding. So I worked a lot with signage, but also getting to work a lot with the COO and the CNO there with nurse and patient engagement.
Yeah, that sounds like an incredible experience, and I absolutely love Marcia. I just spoke to her a couple weeks ago, so shout out to Marcia if she sees and listens to this episode. But you of course you did your internship at SSM Cardinal Glennon, and then after you finished your MPH, you had the opportunity, I'm sure, to go a lot of different directions. MPH students oftentimes find themselves going consulting. Sometimes people get just traditional jobs. Others will go more into government or public service. And then, of course, administrative fellowships are an opportunity as well. What motivated you to apply to a fellowship? And then, kind of, what was that process like that ultimately led you to Connecticut and ultimately led you to Hartford?
Yeah, so I think that's a great question. I think what drew me to a fellowship was I knew I wanted to work in hospital operations still. And so when I was looking for fellowships, I was actually looking for a lot of mentors. And one of the past fellows, I was at Hartford HealthCare actually, her name's Victoria. She reached out to me. I reached out to her and I told her, you know what, I really want to apply to a fellowship, but I know I have an MPH. And how do I make myself competitive enough? And so she helped me along the way with interviews, helping with my resume and my cover letter, personal statement. And so that really drew me to see, okay, I can do this. I can do hospital operations, but also trying to find my niche in it. So at Hartford, I was the nursing administrative fellow, but I'm pretty sure now it's restructured as the patient operations fellow. So I was able to work a lot with the nurses there and get to see also expand my knowledge on patient engagement and how that worked too.
Yeah, absolutely. And I really want to dig in a little bit more into Hartford and also just your experience in general. I know you mentioned that you spoke to maybe an alumni or another fellow. Through the interview process, what was that like for you? Did you apply to other places as well? And maybe what was challenging for you, if anything, during the interview process?
Yes, I think I applied to 8 different fellowships. So I only got called back, I think, to 2. And I think the hardest part was getting the rejections because knowing that I was making myself competitive enough, but knowing that there was somebody always better than me, but knowing that I was doing my best throughout that. So, throughout that, my mentor helped me a lot to encourage me, telling me, you know what, like you have your skills and a place is going to find you and recognize you for your skills. So, I think throughout that interviewing process, I had to really use my imposter syndrome enough and be confident and really understand what is my why and tell my story throughout that. Because I think the most important question throughout it all was tell me about yourself and how does that translate to your story and why I wanted to go into hospitals.
Yeah, how incredible. And I think I'm just going to emphasize the last one of the last things you said is like knowing your why is so important, especially in the fellowship process. And so I'm so glad you were able to obviously articulate that in a way that landed you a fellowship. And so then for people who are interested in the fellowship at Hartford, can you tell us a little bit more about the kind of the overview of the fellowship? Is it 1 year? Is it 2 year? Project based, rotation based? And also, do you have co fellows or do you do the fellowship on your own?
Yeah, I think that's also a great question because I think one thing I was looking for in a fellowship was being in a cohort. So we had about 8 of us, so that was including me, and we were all in different divisions, but it was a 1-year fellowship and project based. So we were all driving projects in the different divisions we were doing. So I was placed at the corporate office with the nurses at the system level, but there were some people that were placed, for instance, I know Georgetown, they recruit a lot from there and they get a lot of people from neuroscience, but also the bone and joint, and then patient engagement. And then there's other different types that people can go into. So I think the fellowship helped me a lot to understand Connecticut and the landscape it had and work with different hospitals there and with one of the biggest health systems that Connecticut has too.
Yeah, that sounds incredible. And, I will say, I think having at least one or two co-fellows, and I mean, a cohort is incredible, but having other people go through that process with you is so, so important because then you feel less alone. Um, and so, building off of that, I know you said that each of the 8 fellows had kind of their own little lane. Was there ever opportunity for you to collaborate with other fellows if there was an interest or if projects kind of intersected?
Yes, I would say definitely yes. It depended on the project and what I was doing. So, for instance, I was working with nurses, but I knew someone was working in patient engagement. So we would be on meetings together just to see how surveys worked out, how also employee engagement. So, how nurses wanted their workforce to be like and their well being, but also understanding how that translates with patient engagement too. So, that was really cool to be along with the fellow, but also we just kind of created that community together. If any of us needed help, we will be there for each other every step of the way.
Yeah, absolutely. Thanks for sharing that. And one other kind of more detailed question that I was hoping to get into with you is mentorship. You and I both know fellowships, they have a huge kind of selling point for them is the mentorship they're able to offer fellows. So could you maybe speak to, who your preceptor was during the fellowship, but then also how you were able to identify and create other mentors within your fellowship experience?
Yes. So my fellowship was pretty interesting. Is that my mentor, Amanda Richards, everyone called her Mandy, left in the middle of my fellowship, and she's now the CNE at Intermountain. And
Okay.
then I ended up getting a different mentor, a different preceptor, and her name was Melkur Skirko. And then I also had a senior preceptor, Vrushangi Patel, and then I had a mentor that they put me with, who was the Professional Development Practice Excellence VP, Worley Remigio. So I had a lot of people on my side and on my team that I was able to kind of span and explore my interests within nursing, but also my interests within healthcare. So if I wanted to do data, how do I build a database? But also getting to understand just how what nurses want and getting to see the different hospitals within that too.
Yeah, that is a very unique and interesting experience. I think it's important to highlight that, changes happen, people do move on, but it seems like you made the best of a very unique situation and were able to identify some mentors for yourself. So I'm happy to hear that. And one other thing that I always love to highlight before we kind of move on to what it is that you do now. So Connecticut, right? Unique state. Definitely, I think a big move, I would say, from St. Louis across the country to the East Coast. So, what do you want to highlight for our listeners that might be interested in this fellowship? What's life like living in Connecticut? Maybe something that surprised you, something that people should expect.
Ooh, okay. So Connecticut can be a very small state, but I knew I wanted to go East Coast for my fellowship. I would definitely say Connecticut has a lot of unique activities for the fall. So whether you want to go to an apple orchard or you want to go hiking, Connecticut is definitely a place for that. But also, it's near a lot of bigger cities because the East Coast is very close knit. So it's cool to see how it's like a family type of community there. But if you get bored also in Connecticut, you can go travel to other cities too, like Providence in Rhode Island, but also New York. And then it also has New Haven. So you get to see what Yale's like and how people live within that area. But also during the summer, I did a whole coastal type of trip with my boyfriend. So we were able to kind of see the different beaches and how the coast is like there in Connecticut. So even though you're inland, in Hartford, you can also go and see the beach on the weekends too, which was pretty cool.
Yeah, how incredible. I love the East Coast, and I think I love that you highlighted the fall. I think, having grown up in Michigan, fall was always beautiful, but East Coast fall is magnificent. And I can only imagine how pretty it is driving with the leaves changing colors and just the beauty. So thank you for sharing that. And, Sandy, I'd love for you to also highlight, what it is that you did after your fellowship. You did performance, you were a performance analyst in performance savings and initiatives, but now, of course, you're an associate government consultant. So, talk to us about those two positions, kind of maybe start with the first one, and then we can move on to what you're doing now.
Yeah, I think that's also a great question. I think as a performance analyst, I kind of switched from project management to data analytics. I wanted to really strengthen my data. So, in that position, I was able to work a lot with primary care physicians and in the value based care space. So, getting to really work with my MPH in that position. I think that helped me a lot to see how people see value based care and how they wanted value based care received, and also how they receive their savings. Because getting to work in that type of space, you get to see how primary care physicians, especially independent ones, work, but also how they see value based care. And I think that's what drew me to my next position. I got to now I get to work in capitation rating. So as an associate with Mercer, I get to work a lot, strengthening my data, but also learning how to do SaaS. I never knew how to do SaaS. And so getting to work on the fly and getting to learn as much as I can in this position, I think is a great experience because that's something I learned in my fellowship is that at the end of the day, you're going to learn so much from your job, and there's going to be so many transferable skills too.
Yeah, absolutely. And it
Mhm.
seems like this role that you're currently in, in Minnesota,
Yeah.
it is really building a very unique skill set that not a
Mhm.
lot of other people may have. So I think that's something I'd love to highlight to our listeners of like what the jobs that you take after your fellowship, really be mindful of what skill set, is being built for you and how
Mhm.
that can help you grow and advance to whatever your next goal is.
Yeah.
Um, I do want to dig in also a little bit into your current role. I know you said
Mhm.
you just moved there, but again, what's it like being in Minnesota? How
Mhm.
is it different than being in Connecticut? And what have you enjoyed living? What have you enjoyed about living there so far?
Yes, so I think Connecticut and Minnesota are very different states, but I enjoyed living in both. In Minneapolis, there's so many activities for young people. For instance, I can walk through a skyway, so that's like our tunnel system. I never have to really go outside, but I try to go outside as much as I can because it's gonna get cold here in Minnesota too. So they understand that the business people have to stay warm to work. There's a lot of concerts. I've been to a few here, so that was really helpful because I love a good music scene, and then there's also a good food scene here. And I'm a foodie, so I love to eat as much as I can, and I think my bank account is seeing that now. But at the end of the day, I've been enjoying it, and I love Minnesota. I think the fall here is great. I'm excited for the winter, but also mentally preparing myself for a lot of people have been saying it's going to be a brutal one. So we will see if I am covered in snow by the end of the year.
No, I appreciate you highlighting this. Having grown up in a very wintry state, it does get really cold, but I appreciate you highlighting, and why maybe you're probably like, why are you asking me all these living questions about living in certain cities and states? I think
Mhm.
important to highlight that for fellowships, people oftentimes will move cross country or hundreds of miles, and even for jobs. So it's very important to
Mhm.
highlight, what lifestyle outside of work is like.
Mhm.
So I appreciate you kind of highlighting that. And kind of the last amount of time that we have together, what I really want to spend it on is your advice for
Mhm.
people who want to apply to fellowships. If you're looking back on your fellowship cycle, is there something you would have done differently? And then what general advice do you want to give early careerists interested in this path?
Yeah. Ooh, Vrushangi, you're making me think. I think some advice I have is to just I know a lot of people say this, but it's to just be yourself throughout the process. I think a lot of times I was trying to read the room too much in my interviewing, especially because my interviews, and you understand this, a lot of our interviews were through Zoom. So it was in this climate where we didn't understand if someone was really understanding that what we wanted out of them, but they just wanted to get to know us and get to know us as people. And at the end of the day, they knew that we were human. So I think that's something that I needed to just like wrap my head around. And so I've been telling a lot of people that, you know what, you just need to take a deep breath before the interview because at the end of the day, you are qualified. They wouldn't have interviewed you if you weren't. And so you have to turn on that imposter syndrome as fast as you can, but also understand that you are the candidate and they're just trying to see if you are a good fit. And so I think that's something that I also learned is that wherever I ended up was the place I was supposed to end up. There was a lot of disappointment I know throughout the fellowship, and like it's a very emotional process because you always try to like rank your first. But I am very happy where I ended up. And I think Hartford HealthCare really gave me the confidence to go through a lot and to just be myself and to understand what I wanted out of my career as I move forward.
Yeah, absolutely. And I really want to hone in on a couple of things that you said that really resonated with me. And just so our listeners really take it home with them. First, you're so right. Having gone through the fellowship application cycle during a a COVID slash post COVID era was very interesting because prior to that, people were flying people out everywhere. And then for me, most of my final rounds, except one, was all over Zoom. So I think navigating that, such an interesting experience. But um one thing that you said that I really want to end on is the sentiment of you're going to end up where you need to be. And if you're in that interview room, there's a reason for it. And, I think for me, sometimes with the identities that I hold, imposter syndrome is so real. And you're kind of like, how did I get here? Do I belong here? Like, what is going on? And so I want to thank you for highlighting that because that's a feeling that so many of us, I feel like, go through and it's not talked about enough. But you did it. You got a fellowship, and
Exactly. Same to
obviously,
you.
yeah, we can. Yes, exactly. And we've moved on past our fellowship roles as well. But I just want to thank you. I think, you highlighted some incredible advice throughout this episode, and I know it's going to be valuable for people trying to, first of all, right off the bat, apply to a fellowship with an MPH. And then, second, going through that process and then landing somewhere post fellowship as well. So, really enjoyed catching up with you, and thank you for coming on.
Thank you.